In the past decade, the Affordable Care Act has gotten health coverage to almost 50 million Americans. Republicans have gotten their butts kicked fighting it so many times, you could be forgiven for thinking they've given up repealing it. But they haven't. They're hoping to take away a key feature that makes it all work. J.D. Vance explained how on the campaign trail last week.
We're going to actually implement some regulatory reform in the healthcare system that allows people to choose a health care plan that works for them. Now, what that will also do is allow people with similar health situations to be in the same risk pools, so that makes our healthcare system work better. It makes it work better for the people with chronic issues. It also makes it work better for everybody else.
It doesn't make it work better for the people with chronic issues. In fact, if you stick people in different risk pools, depending on their pre-existing conditions, chronic issues, that sounds familiar, right? It's because it was part of the Republican House attempt to repeal and replace the ACA all the way back in 2017. I remembered. I covered it night in, night out. A tiered system of insurance, the Congressional Budget Office said, would create a situation for people with expensive conditions in which premiums would be so high in some areas that the plans would have no enrollment. The whole point of health insurance is that premiums from healthy people help subsidize benefits for people with chronic conditions. If you start segregating by risk, well, that's great for young, healthy people. They'll pay less because they need less care. But if you're old or sick, your premiums are going to skyrocket. And the thing about human life is that all of us will go from one category to the other, which is why you want one risk pool. So Trump and Vance's concept of a plan is to go back to the exact same bad idea Americans have rejected over and over again for the last 10 years. Javier Becerra has served as the Secretary of Health and Human Services of the Biden administration since 2021, and he joins me now. Mr. Secretary, it's good to have you here.
Thanks, Chris.
Let's just talk about the structure of the ACA, just as a matter of policy, as the man who probably more than any other individual in the government oversees the implementation of the Affordable Care Act. What would happen if you changed it structurally so that you started segregating out different risk pools?
What would happen was we would see what we saw before 1965 when President Johnson enacted Medicare. Old people had a hard time finding insurance. Why? Because, as you said, if you're old, you're probably getting sicker faster, more often, and you're costing an insurance company more. So insurers did not want to insure older Americans. It took Medicare, where the federal government came back and financed and backed up the system to finally get 65 and older Medicare health care coverage.
Right, because why do you want to take premiums from a 69-year-old or a 72-year-old, no. Right? You don't. You want a 21-year-old.
As you said, you want the healthiest, youngest, wealthiest people to be on your plans.
And in fact, the old system sort of worked through this kind of cherry picking, right? I mean, even after you have Medicare, right? So people are 65 or older are in that pool. But I remember looking at some of the ACA repeal plans, estimating premiums for someone who's 63. Right? And maybe has had some health issues. You're looking at $20,000 a year, $26,000 a year. There's no way to make the math work, is there?
Yeah, no. What happens is people will pool to where they can pay least. And if you're 26 years of age, you're not going to go in with someone who's 56 years of age.
You want to pay.
And so what happens is all those 50-year-olds are going to be stuck in plans that are very expensive because nobody wants to be pooled with them. And the ACA made sure we prevented that. That's why we have the protection against pre-existing conditions. You cannot watch an insurance company say to you, Chris, I'm not going to insure you because you have an existing condition which would cost a lot of money. You cannot discriminate that way anymore.
Just to be clear, you couldn't, I actually don't know the answer to this question. Could you, what Vance is proposing or what others are proposing, could you do that administratively from the helm of HHS, or you'd have to pass something, right?
I think we couldn't do it that way. Well, certainly not.
The law requires what's called community rating, and the law requires this regulation of insurance companies, right?
And the law doesn't allow you to pool the way that I think they're speaking about, because it would be discriminatory. It would now be based.
Right.
Yeah.
Right. So they'd have to change the law. You can't do it from the executive position.
Correct.
I wanted to ask you another question about a public health crisis we've been battling in this country, and I think it's gotten not that much attention. It's overdose deaths. Now, it's almost impossible to articulate the insanity of the growth of overdose deaths. I think I was reading a piece today by David Wells in the Times. I think in 1982, it was like 1,000 overdose deaths total in the country. Last year was about 100,000.
Yeah.
Right. That said, we have new data on overdose deaths. that have continued to drop. They're now at their lowest level in 3 years. There has been progress over the last few years of overdose deaths. What do you attribute that progress to?
Remember that many of the Americans who are dying today are dying without expecting to die. These are not folks who are so addicted that eventually they were going to overdose. These are Americans who in many cases are taking a particular drug, don't realize that it's laced with something like fentanyl. The fentanyl ends up killing them. And that's why you see such high overdose rates. We are beginning to see a drop, I think, because we have, in this administration, we decided to tackle overdose in 3 important ways and then added 1 new one. Obviously, prevention, treatment, and then follow-up care. But we added a 4th component, harm reduction. If you are about to take a drug because you're addicted, and if you can check to find out if it's laced with fentanyl, it might stop you from taking that drug if you find out, oh my God, I didn't realize this drug is laced with fentanyl. Fentanyl strips, which are out there today in many, many programs, the federal government would prohibit programs from getting federal dollars if they provided fentanyl strips. We have said the evidence proves that you can save a life by giving someone a fentanyl strip so they can find out if fentanyl is laced in their drug.
You know, this harm reduction, I've covered multiple iterations of the harm reduction debate. I remember people demagoguing on needle exchanges and things like this during HIV. Fentanyl strips seem to me like an obviously sensible thing.
Simple.
But has this been a controversial program or not?
On the ground, no, because it's saving lives. At the federal level, because you get into this politic of drugs and so forth, yes, but it's proving itself a winner. And today, more people are living. We've also made naloxone more available to folks so that if you're ODing, somebody finds you there, you can provide them with a drug that will help reverse that overdose.
Yeah, naloxone being a drug that can interrupt and stop an overdose, but has to be given essentially within a few minutes of the actual.
And so now that's available over the counter. That wasn't before, but this administration has made it available so we can save lives.
Secretary of Health and Human Services, Xavier Becerra. Thank you so much for coming by. Come by the studio anytime.
Thank you.
Enjoy New York.
Thank you.